Welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. This is Dr. Daniel Ronel. I'm a plastic surgeon. I'm here with Lanya Deerholt from Fit Weight Loss.
Right.
And my wife Betsy. And
Still
we've been
here.
talking about, we gotta stop saying that.
I'm still here.
We gotta stop.
Not
And
going
we're talking
anywhere.
about,
All right.
medical weight loss. So Lanya told us about the appetite suppressants, the education about diet, how to read labels, the weekly follow-up. These are all critical things that empower somebody to lose weight. What I found is a lot of my patients who, for example, come for tickle lipo or an abdominoplasty have a lot of visceral fat. They have the fat that's around their organs. And I can suck or cut out the stuff that's
On
closer
top.
to the skin.
Right.
But that doesn't really change your shape, if you're barrel-shaped or pear-shaped. And so I say, if you really want to have that flat belly, you got to do something else about the stuff on the inside.
Right. That's why our programs work so well in conjunction with plastic surgery centers. We are housed inside plastic surgery centers in Scottsdale and Albuquerque as well. And we do cross-refer patients. For patients that, lose 150 to 100 pounds, they may have some extra skin, some extra tightening, and then just like, so let's finish up with some tickle lipo or something like that. But even beforehand, maybe before they come in as patients, they get referred to us saying, maybe you want to lose this first 40 pounds and then come back and see me.
Right. I send some patients to them who, if they have, if you're 10 to 15 pounds more than where you want to be, surgery usually takes care of that because your body consumes itself as it's healing. But
I'm one of those people, and I would say I know how to eat, and I know when I want to gain weight, I gain it if I feel like it. I know how to lose weight very easily, but that's me. But I'm one of those people, 10 to 20 pounds, where yes, I could get tickle lipo or something like that, but if I didn't really know how to eat and I was always like this with this extra 20, I'd really go to you for that last little knockoff and learn techniques and tricks and ways around food and with food to get myself at a weight I'm comfortable with. Then you can play with it as long as you know how to get back.
Exactly, and I think a lot of women have, that 5-pound gainer loss. It happens, maybe over the holidays, Super Bowl parties, birthdays. Exactly.
Yeah.
But if you have the tools, then you know how to get back on track.
Exactly, and that's what I think they're essential for. You don't have to be massive weight loss to just go there. You can be the last, little bit that you want to lose, and you'll learn tools. And how does this differentiate between, those national companies we hear about on TV, like the Jenny Craigs or the Weight Watchers? What is different?
Well, mostly it's not prepackaged food.
Right.
They're cooking, they're shopping, they're making their own selections. We have had many patients that have come to us that have tried Weight Watchers or Jenny Craig before, and they did lose weight initially, but when they were kind of on their own, then they kind of went back to their old ways, and they didn't want to be tied to prepackaged food for the rest of their life.
That's just not American.
Well, well, it's very American. Actually, prepackaged food is what this country is made of. Yeah.
No, my point is that you get your meals sent to you in the mail. I mean,
Right.
it works for a little bit, but we like to go out and shop and buy things.
Right.
And you go to a fruit stand as you're driving
Yeah,
somewhere.
but people also like. I'm not defending. I don't agree with those programs. I like the medical weight loss, which makes you fend for yourself. You're doing the action that you need to continue to do to stay healthy.
Right.
And my issue with foods like that is they're loaded with sodium and preservatives.
Right.
So
It's not fresh.
no, it's really
It can't be.
It's no way. So that's what I love about their program is the Fit Medical Weight Loss is like we said, they're giving you the tools to go out and learn yourself, practice yourself how to maintain a health and get to a healthy weight.
Right. Plus, we all like to eat out sometimes and be able to, and so you've got to be able to step outside the boundaries of food that's being sent to you and know what to do.
Right, and you'll know. Okay, let me eat this extra high fiber salad, and then I can eat the chicken parmesan if I want. But one thing cancels out the other. Yeah. Okay. Good.
So Scottsdale, Santa Fe, Albuquerque. That's great. The plastic surgeon Mike Hopkins in Albuquerque is a great guy.
He's great.
I really like him.
Dr. Hopkins in Albuquerque.
He's
a wonderful doctor.
He's excellent.
We started with him. Been there for a couple of years now.
Yeah.
It's a good fit.
Yeah. No, he's a very well respected.
Do you have plans to expand to other cities, or do you want to stay?
Well, we're gonna actually focus on Rio Rancho next.
Oh, that's a good spot.
So
yeah.
we're looking for a plastic surgeon to partner with in Rio Rancho. I don't know. I wanted to ask Dr. Hopkins actually,
Yeah.
if
There
you
are
had,
no
or if
plastic
you have.
surgeons in, I used to have an office there.
Oh, okay.
And it
Well,
would-
someone would happily drive over there. I mean, he used to drive over there.
Really?
Yeah,
Yeah.
but there is not one in.
Rio Rancho.
Yeah,
Amazing.
I'm the closest one because I'm on Paseo del Norte, right?
Right,
next to it.
right.
So,
Well, between
That's a fact.
Hopkins and Dr. Ronel, they
Yeah.
can tell you some people that might be good and interested.
but that would be a
for it,
great
yeah.
place because, as we all know, Rio Rancho is one of the largest growing.
It's growing and
places.
it's so expansive.
Yeah.
You know, there's communities that are just so
Mhm.
far out that, you know, I do think that there would be a use
Yeah.
for our services.
They have it planned out all the way to Grants, actually.
Wow.
From,
That's
right.
amazing.
It's already all planned.
Yeah,
The
for the
roads and
future.
everything.
I mean, that's smart, you know, because they know it's gonna grow. Now, in terms of cost, are you able to say a general, or is it per person?
Yes, well, we actually wanted to extend a special to any listeners.
Oh,
So
excellent.
for
Good.
the first visit, the initial consultation, we will extend $75 off of that. It's
Wow.
usually $275. It'll be
Oh,
just
excellent.
$200 for
Oh,
that
that's
first
excellent.
visit. That covers
Excellent.
all your medications, the time with the doctor, the EKG, and all the lab
Oh,
work.
that's
And
nothing.
all your program materials, exactly.
Wow.
Plus, we do B12 injections. We
Mhm.
use a compound pharmacy, and we add some additional amino acids to help also with appetite suppression, and that will come with every visit as well.
That's
So
awesome.
listeners, call in, tell us that you
Good.
heard us on this show, and
That's a
we'll
great
And where do
extend the
they call?
$75. They will call 888-9575 or in Santa Fe at 820-7062.
Okay,
Excellent.
excellent. And you
That's
can
terrific.
also call my office and we'll refer you.
Right,
and
or go to their website, which is.
The website is fitmedicalweightloss.com.
Right.
FIT medicalweightloss.com.
And this is do-it-yourself weight loss once they give you the tools
Right.
and make you relearn what you think you already know. You
It's
know.
a good way to put
Yeah,
it.
yeah, it's
No.
gentle and wonderful and it's fantastic.
Yeah, I think it's great. It's a fantastic mix with plastic surgery. We've always said a lot of times when a patient comes into my office, that's an opportunity for me to do something more
Make a
important.
real change,
Yeah,
right.
even more important than mere physical change. You know, whether it be smoking cessation or dealing with a spousal stress or weight loss. And we had a wonderful nutritionist until, you know, a year or two ago.
Passed away.
Who passed
Mark
away,
Wood.
you know, and
His reputation.
and there was really a lack. I was missing being able to refer my patients to someplace for,
Right.
you know, their nutrition. Now I can, which is really, really terrific.
Yeah, no, it's good.
Well, thank you so much for coming up here
Yeah, all
Thank
the
you.
way up
Oh.
here,
and
thank you.
explaining this to us.
Yeah.
And
That's
we'll
fine.
have, good, we'll have you back on in a couple months.
Okay.
And we'll follow up to see how it's going.
Yeah, I mean, they're around, this is a substantial business, they don't
Yeah.
need our help,
No.
but you know, it's always fun.
Yeah,
It
I'd
is
like
fun,
to-
and it's good. It's
Yes.
a new audience.
Exactly,
good.
exactly, good, all right.
And thanks for listening to Talk 1260 KTRC. This was the Humanity Behind the Vanity, Dr. Daniel Ronel, and we will be back next week. And give us a call. We've got a lot of Valentine's specials going on right now, about 15% off anything. So come on in.
And check evalleyshelter.org for the Espanola
course.
Valley Humane Society volunteer opportunities. There are a lot for the rest of the month. And
Thanks to everybody who rescued the dogs and cats in the freezing
Oh,
cold.
Yeah.
that
last
was
week.
awful.
they didn't rescue, they
Yes.
fostered them.
They fostered
Yeah,
them,
which
yes.
was outstanding. We had an outpouring of support, propane, the little mobile heat machines.
Blankets.
Yeah, blankets, water, and homes themselves to take those sweet little creatures
Mhm.
home for a little while to keep them safe. Anyway, so always check evalleyshelter.org because I
Okay.
can't help it. I love them.
Thanks.
Okay, all
Bye-bye.
right, thank you.